Hi, I'm Dr. Loretta Stamba, and this is ADHD Part 2. Today I'm going to speak a little bit about the specific treatments that you use for kids with attention deficit disorder, with or without hyperactivity. The first thing to note is that 1 in 10 kids are diagnosed with ADHD, and of those children, many of them have comorbidities or other conditions alongside the ADHD that makes the treatment sometimes a little bit challenging, but the main thing is to have a multi-level approach and also to have multiple people involved in the process and close follow-up. Of the kiddos who we put on the stimulant group of medications, only about 75% of them will actually respond to those. And it's sort of a trial and error thing. There are different forms of those medications. You can take tablets, you can take sprinkles, you can take liquid form. There's even a patch that you put on for 9 or 10 hours and take off at the end of the day. All of these can have their own issues, both good and bad. But the main thing is to find something that you think that your child can stick with, and something that won't be a struggle every day, because of course that won't be helpful to anybody. The main thing is that the stimulant group of medications, with that come a lot of side effects, but they're very good. If you actually have a true diagnosis of ADHD, most of the time we can get the kids to a good spot, in a good space, that they can function better and they can stay organized and focused and be more successful. The main thing to think about with the stimulant group of medications is that we'll have to monitor the kids very closely. In our office, we do it every 3 months normally. And you have to watch the kids for appetite changes, so weight changes. Of course, they can be insomniacs because they can be revved up by the medication if it lasts too long into the night. So sleeping issues is a problem. There are some side effects with belly pain, headaches, and tics, and skin picking. But most of these things we can sort of weigh and say, well, it's helping the child more than it's hurting the child. And it all depends on if there's a social component to this, and, if kids are getting bullied for different things, and it's hard for them to deal with, say, a tic, if they're already having some social issues with relationships. So that's important. The second thing is, everybody worries, will my child's growth be stunted if they're on one of these stimulant medications? Actually, there is a little bit of a decrease in the rate of growth for these kids, but when they do head-to-head studies at the 10-year mark with kids and peers who have never been on a stimulant, everything levels out. So for me, that's reassuring. Now, if you have a child who's losing lots of weight and we try all our different measures and we can't get them to gain weight, then that might not be the right medication for them. The other family, within the stimulant family, I'll tell you, there are basically 2 families within that, but they're all basically doing the same thing, which is working on the dopamine levels, which control emotion and impulsivity, and can help with both the hyperactivity component and the attention part. So, the main thing is to remember, when you have these medications, you're working, a particular part of the brain is going to be have more access to this dopamine, which is a neurochemical that works in your body. So it basically is keeping the dopamine in a space where your nerve cells can better utilize it, your brain can better utilize it, put it that way. And so that helps, because they really think that that's part of the ADHD, is that your dopamine levels are really low. So you wonder, well, why would I give my kid a stimulant and stimulate them more if they're very hyper? Well, if your child has a pretty low level of dopamine here and normal is up here, you're going to bump them up to the normal spot with these medications. And so you're starting at an abnormal lower level. And that's why your kids don't end up, above normal, where they're bouncing off the walls normally, unless there's some other anxiety component or something. It's not treated. But the other family medications is the non-stimulant group. And so this is similar to drugs you might have heard, maybe Strattera, Intuniv. These are different mechanisms of actions with these drugs. And so far, I've probably had a pretty good experience with the kids going on these medications, specifically those who can't take stimulants for some kind of reason, if they have some kind of cardiac issue, or if the side effect for them is really not conducive to their life, or if it's just not working. And the other part of this is that if you have a kid on a stimulant, sometimes you can get what's called emotional blunting. So this is when parents think, well, my kid is just not their normal self. They're flat, or they're, kind of blah during the day. Their personalities, blunted, or not really what it was. And so, of course, this is not one of our goals. I mean, we want to keep your kids spunk and spirit alive too when we're treating with these medications. But the problem is that you get this emotional blunting sometimes with the stimulants, and what you have to do oftentimes is piggyback a non-stimulant on top of it to counteract this, because the non-stimulant actually works in the executive functioning part of your brain. So it's sort of the leader of everything, and can counteract the emotional effect. So that's important to know. The other thing is, I mentioned last time, cognitive behavioral therapy. It is really, really vital for this to be on board. It's first line for kids who are under 5 or 6, I think. And I consider it first line when I'm practicing for the kids above 6, because I feel like we need to have that on board no matter what. And so that's usually one of the first things I'll do, and then make sure we're on the right track with the diagnosis, and we're treating, we all are treating the right thing in the right context, and getting all the information that we need from the psychologist. We can sort of make a game plan as to if we need to try a stimulant or a non-stimulant on top of it. But the therapist that we recommend, the cognitive behavioral therapy techniques, can really help with day-to-day organizational skills. This is basically helping your kids have better behavior and knocking out the bad behavior if you can. So rewarding good behavior and giving them privileges, and the opposite for negative behaviors, trying to get them on track and recognize things that are not acceptable. And so it gets very involved. It's different for each kid, but we can certainly help you with that. It helps with interpersonal skills with these kiddos, with the relationship skills, and relationships between the family members that are in the house, because this is a chronic illness. This is something that doesn't really, you don't end up really outgrowing it. You just end up coping with it differently. So it does affect the family as a unit, and over time as well, affects the family over time. So I think it's important for everybody to be involved. I think it's important for good communication between the psychologist and the pediatrician, and then the pediatrician and the family, of course. We need to sort of monitor the basic things like heart rate, blood pressure, if kiddos are on stimulants, or, basically side effects, tummy aches, headaches, fatigue, side effects, things like that if they're on the non-stimulants, or even the stimulants can do that occasionally. But we have to sort of approach it as a team, approach it as a chronic illness, and approach it as something that's not, it's challenging, but it's really not, something that has to be such a negative thing for these kids. There are a lot of strengths, like I said, for these kids, and we need to really focus on that. We need to learn how to focus on that, and bring it to the table so that these kids don't feel inferior, and they don't feel, like they're different, because that affects their self-esteem in many ways. And, kids have a hard enough time, and that's sort of one of my my biggest, should I say, goals with my own kids, is to sort of have them grow and be self-confident kids with high self-esteem, and assertiveness, not aggressiveness, and just sort of comfortable in their own skin. So that's it for now. If you need anything, just call us. If you're one of our patients, we can certainly see you in the office if you're worried about anything. We all treat ADHD. We all do it pretty well. And we do have integrated health in our office, psychologists right in our office. So give us a call. Hendersonville Peds. Thanks.